Good evening, students. It is 7 p.m. sharp, and we will be taking neurophysiology lecture till 8 p.m. and I will not exceed it more. Okay. Welcome. Okay. Now, yesterday we had this 1 hour 42 minutes lecture. Okay, and for my students today who are not able to take this live class, the recordings will be updated by night. And for the ones who are able to take live classes, as I have this constant student, Maria, so it's good. Thank you so much that you have such a patience to attend lectures one after the other. So today, when I was teaching pharmacology, kindly mute your mic, whoever it is, please. Thank you. Okay, so today, when I was teaching you this pharmacology, kindly mute it. Thank you. Okay. We have studied till the autonomic, all that nerves, long and short, okay, the postganglionic and the preganglionic things. We have studied all that, right? But the part that is remaining was this neurotransmitters, autonomic neurotransmitters, and the receptors. Okay, so today I will be taking you because it is a part, basically it is not a part of pharmacology, it is a part of neurophysiology. Okay, but because it is given in your first aid as well in pharmacology and BRS physiology as well, so I will be teaching you today in BRS physiology, and we will skip this part and pharmacology tomorrow, and I will take you with the autonomic drugs from first aid tomorrow. Okay, so that will save your time and my time as well, and will save the repetition. And if you want to like go through it, so I will update these recordings by night. So if any student who has joined like just now and have not taken any of the classes before, can inbox me later after this lecture. I will reply you about whatever this course is. Okay, if you do not know about the details yet. So welcome in people. Now, yesterday lecture on neurophysiology was about this organization of the autonomic nervous system. Now you see, BRS physiology is such a high yield book that same as first aid, every line of it is very important to understand. There are no pictures in this book, and this book is very high yield. We do study this book for all sorts of license exams and board exams, even in future, like even postgraduate exams, we do study BRS physiology. So if you like study this now at this particular level, you will have no problem in going through this book again and again. Okay, so yesterday I taught you regarding this organization of autonomic nervous system. Also I told you about the central nervous system, the peripheral nervous system, the brain and spinal cord, the anatomy of it. So that is why yesterday's lecture was of 1 hour 42 minutes, which was really long. Today lecture is based on neurotransmitters of the autonomic nervous system. We have studied till here. Okay, so I will continue it from here, and this will cover your pharmacology portion as well. Okay, so before wasting more time, okay, the autonomic nervous system has, similarly as I discussed in the morning, the adrenergic and the cholinergic neurons. Okay, all those neurons that release acetylcholine, they are termed as cholinergic, and all those ones that release norepinephrine or epinephrine or dopamine, they are termed as adrenergic neurons. Okay, so we have cholinergic in sympathetic also, such as I told you from the first aid book, that picture, if you remember, of sweat glands. Okay, Sweat glands have this acetylcholine release, and that is the cholinergic neuron, but a part of sympathetic nervous system. Welcome everyone. Similarly, the adrenergic neuron releases norepi, and dopamine. Okay, so that is why they have written over here that cholinergic neurons, whether in the sympathetic or parasympathetic nervous system, release acetylcholine as a neurotransmitter. Okay, so that's what I have showed you when we were admit. Okay, that's what I showed you in the from the first aid book. Okay, now noradrenergic non-cholinergic neurons, okay, non-adrenergic, that they're not adrenergic, they are not cholinergic, include some post-ganglionic parasympathetic neurons of the GI tract. Always remember, the GI tract do not have this autonomic nervous system. The GI tract has an enteric nervous system, okay, and there are some of the neurons in the GI that do not release epi, norepi, or acetylcholine. So if you remember that that picture which I've showed you, you guys can remember from that these enteric nervous system have some other substances like substance P, vasoactive intestinal peptide, and nitric oxide. Okay, so these are non-adrenergic and non-cholinergic. So I kind of take you to my notes back again. And for the people who were not present yesterday, we have covered this all portion. In my notes, this is basically neurophysiology notes. So in my notes, I have put in these some things about anatomy also to build up your base. If you do not have a good base of neuroanatomy, you can't like grab neurophysiology well. Okay, so this was the picture which I used in pharmacology lecture from these notes. Okay, I have discussed all this part in yesterday's lecture, every page of it. So today's lecture will be starting from here, from this picture. Okay, and it is the same picture which is in the first aid also. Okay, that we have these sympathetic neurons, red one, and a blue one is the parasympathetic, and we have this you see this is the preganglionic fiber and the postganglionic fiber. So the preganglionic fiber releases acetylcholine, and the receptor present over here will be nicotinic, okay, because nicotinic receptors receive acetylcholine. Then this is the postganglionic fiber, which again releases acetylcholine, and the receptor present over here should always be nicotinic again. Okay, nicotinic or muscarinic, mostly muscarinic. Okay, the postganglionic acetylcholine is the muscarinic, and the preganglionic one receptor is the nicotinic receptors. Even in here, these are the red ones are the sympathetic fibers. Okay, even in here, these preganglionic receptors are nicotinic receptors. Okay, and then these postganglionic ones are, this one is of sweat glands, this is the muscarinic receptor, and this was the exception I told you to remember. Okay, but these of heart and blood vessels and of gut, okay, these all are the adrenergic receptors, alpha 1, alpha 2, beta 1, beta 2. Then if you remember from my previous lecture, I told you regarding this adrenal medulla thing that it has a long preganglionic fiber, okay, which has this potential to release acetylcholine, okay, and then it activates the adrenal medulla. Okay, there are chromaffin cells present over here, and they release, and these chromaffin cells release epinephrine. Okay, and that epinephrine directly goes into the blood, and from there it affects on the heart. And what type of muscles? The cardiac muscles of the ventricles mainly. Okay, also of the SA and AV node, but of the ventricles mainly. So you have to kind of remember my today's lecture on pharmacology to understand this part. Okay, so most of the people right now who are live are kind of have got that pharmacology lecture, and I will update the recording by night, so you can grab that from there. Now let me go back to the book, because we have to touch the book. Okay, now let's study this chart from this BRS book, Organization of the Autonomic Nervous System. We have this sympathetic, parasympathetic, and somatic. Somatic is not is separate from autonomic. Okay, this is not a part of autonomic nervous system. This is different. So if you remember that picture, if you remember this picture, I told you about these cranial nerves 3, 7, 9, and 10, the parasympathetic ones, and the pelvic splanchnic nerves S2, S3, S4. Okay, so this parasympathetic has a nuclei from the cranial nerves 3, 7, 9, and 10, and spinal cord segments S2, S3, S4. That is why we say the parasympathetic is craniosacral. Okay, remember from the pharmacology lecture today. And sympathetic, again from this picture I told you that it is from T1 to L2. Okay, that is why we say that sympathetic is thoracolumbar. Okay, so you see this is T1 to L to T12, and then L1, L2, L3. So this is thoracolumbar. So you have to, these things are really important, because the origin, okay, it is very important, because it is asked in like anatomy as well. It is as it can be asked in physiology, it can be asked in pharmacology. So it is kind of repeated everywhere again and again. So you have to remember the origin of the preganglionic nerve fibers. Okay, then the length of preganglionic. In case of sympathetic, I told you they are short, and in case of parasympathetic, they are long. Why they are short and long? They are short and long because the sympathetic ones, this autonomic, this chain of autonomic ganglia, it is also called paravertebral ganglia, okay? Because it is along, you know, alongside the vertebral column. So that is why we call it paravertebral, okay? That is around the vertebrae. So this paravertebral chain of autonomic ganglion is nearer to the spinal cord, okay, and far away from the effector organs. That is the reason the sympathetic preganglionic fibers are really short, and the sympathetic parasympathetic postganglionic fibers, these dotted lines are the parasympathetic postganglionic fibers. They are long. Okay, so that is what written here in this chart, that the length of preganglionic nerve axon in sympathetic is short. Okay, and similarly the length of postganglionic nerve axons is long. So you kind of have to remember these two things for the purpose of pharmacology as well as physiology. Okay, now when we will go to the parasympathetic one, these blue color, these are the parasympathetic ones. So you see these are the ganglions which are nearer to the effector organs. So the preganglionic parasympathetic fibers are long enough, because they have to travel from this cranial segments to the effector organs. So they are long. And then from this ganglion, because these ganglions are situated nearer to the effector organs, the postganglionic parasympathetic fibers, these blue color dotted ones, are really short. Okay, so that is what written in here, that the length of preganglionic nerve axons in the parasympathetic is long, and in the postganglionic in the parasympathetic is short. Okay, you're getting my point? Then they have told you about this neurotransmitter in the ganglion. Okay, so when they're saying the ganglion, they specifically means these ganglions, or these ganglions. Okay, are these ganglions. This specifically means ganglions, okay? So if I ask you about this parasympathetic supply and these ganglions, what is the neurotransmitter being released at this particular level? There will be acetylcholine, okay? And similarly, if I talk about the sympathetic ganglions, the neurotransmitter would again be acetylcholine, okay? It will not be epi or norepi. At the level of ganglions, either it is parasympathetic or it is sympathetic. The neurotransmitter is always acetylcholine. Do not get confused with sympathetic or parasympathetic. Where the neurotransmitter changes is at the level of effector organs. Okay, is at the level of these effector organs. So you see, under sympathetic, they have written the neurotransmitter in ganglion is acetylcholine, and same parasympathetic, the neurotransmitter is acetylcholine. But when I talk about the neurotransmitter in the effector organs, under sympathetic, we have this norepinephrine, okay? Except sweat glands, okay? Just mug this point. This is the most favorite MCQ, that the neurotransmitter at the effector organ, sweat gland, is what? And students do confuse because they take glands in the sympathetic supply, because when they see sympathetic word, the neurotransmitter strikes is norepi in case of effector organs. But there is only one exception. There is only one exception. So just remember this point. I guess we have a picture here. This is not so good. This picture was good enough. So you see this fiber, this first one, okay, this is sympathetic, red color. And at this particular level, at the effector organ level, you see sweat glands, it is releasing acetylcholine. But all other fibers, all other sympathetic fibers, be it is adrenal medulla or any other organ, any other effector organ, the neurotransmitter at these particular levels will be norepi or epi. So you have to mug this sweat glands point in your head for the purpose of MCQ, okay? Then we have this receptor type, okay? I've already told you that at the level of ganglion, the receptors are always nicotinic, okay? Now you see this picture. You see this picture. This receptor is nicotinic receptor because this is the ganglion level. This is the ganglion level and the receptor is nicotinic, okay? This is the ganglion level and the receptor is nicotinic, okay? And also in somatic, you will see nicotinic. So at the level of ganglions, the receptor is always nicotinic, okay? Be it sympathetic or be it parasympathetic, it is same. So the neurotransmitter at ganglion level in both is acetylcholine. The receptor at the level of ganglion in both is nicotinic. Then we'll see the effect at the level of effector organs, okay? What effector organs are involved in case of sympathetic is smooth and cardiac muscles. But again, I want to repeat it again and again to you people that whenever they talk about smooth, make sure you are clear with the concept that these smooth muscles they are talking about the endothelial lining of the blood vessels. They're talking about the detrusor muscle of the bladder. They're talking about the bronchial muscles, okay, of the respiratory tract. They're talking about the GI smooth muscles, okay. So smooth, wherever it is written smooth, it involves all of them, okay. And same goes with the glands. Same goes with the glands, that all the endocrine glands they are talking about, okay. When they're talking about cardiac muscles, you have to remember that in case of sympathetic, they are mostly talking about ventricular cardiac muscle, okay. But when they are talking about parasympathetic, it involves both atrium and ventricular cardiac muscle. So these are some exceptions which are not particularly well written in books, but if you read, bigger textbooks, you will understand this point. Then, okay, now this point is pretty clear that the if neurotransmitter in parasympathetic at the effector organ level is acetylcholine. But when we talk about the sympathetic, we have norepinephrine with an exception to sweat glands which use acetylcholine. Okay, and then the receptor types in effector organs. Now the receptor types, okay. So you see, I have told you that um, the the neurotransmitter acetylcholine, okay, when it is present in the parasympathetic, okay, when it is present in the parasympathetic, the receptor must be muscarinic. Okay, so you call this muscarinic receptor at this particular level. But at this particular level, these will be nicotinic. So always keep in mind that when you're talking about the receptor types in effector organ level, it is muscarinic. But when you talk about receptor type in ganglion and it is acetylcholine again, that will be nicotinic. So don't mix up these things, okay? Keep yourself really clear at this particular level. Then when I'll talk about the sympathetic, you all know and remember alpha 1, alpha 2, beta 1, beta 2. Okay, so now this is the picture. Okay, you can just see it once again. The preganglionic fiber is pretty much long, the postganglionic fiber is short. Then in sympathetic, the preganglionic fiber is short, the postganglionic is long. And like, always study with reasons. This medical science has reasons to everything. Why these fibers are long? Because the ganglions are present nearer to the organ. Why these fibers are short? Because the ganglions are present nearer to the paravertebral chain. Okay, this picture, just mark this picture. This is a very good picture. Okay, you see they are nearer and they are far. So I'm repeating it again and again so you might learn. Another important point, you should know that when from the adrenal gland, epi and norepi releases directly into the blood, the quantity of epinephrine is more than norepinephrine. So this is a tricky MCQ, that epinephrine is released more than norepinephrine. Okay, 80% is a huge amount. Okay, then there is this somatic nervous system which is not a part of autonomic nervous system. Okay, and it only has one long fiber that releases this acetylcholine. Okay, and this acetylcholine if works on these skeletal muscles, okay, having the receptors, nicotinic receptors, and we also called as neuromuscular junctions, NMJ or NM. Okay, these receptors, the ganglion one will be always NN, but these receptors will always be NM, the neuromuscular junction. Okay, so keep these little points in mind. They are very helpful in examinations. Now this is now till now, whatever I was discussing with you, we have already gone through in pharmacology lecture today as well. But there are many people who have not taken that lecture, so I have to repeat. Basically, this is new, okay, and I will be teaching you this mechanism of GQ, GI, and GS, okay, and how these things looks really complex. This is pure biochemistry, okay. So, and we have studied the receptors with the locations. Okay, so we will kind of repeat it. I will take you back to my notes for this. These are all same things, okay? These are all same things from the book. It's just written over here also. So that's why I'm not reading and repeating it. And this is what we studied in pharma today. Okay, I will repeat it, don't worry. I'm just going to the mechanism of actions of the receptors. This is another chart. Okay, the same, that one is given in BRS. This is another chart. Okay, this is from the Snell anatomy. Okay, it is the same chart as the BRS. So if you want to kind of read it, go through it, it is present in the notes. Okay, this is same, but it there is some addition to it. They have given the name of drugs in it, but BRS also have this kind of a separate chart. So we will be studying that from that book. Now, mechanism of action of adrenergic and cholinergic receptors. Okay, so we see if you like learn it this way, it will be easier for you rather than learning it from the chart. So you see this alpha 1, it has this GQ, and alpha 2 GI, and beta 1 beta 2 both are stimulatory. So I don't know what Q means, but I means inhibitory and S means stimulatory. Okay, so beta 1 beta 2 both are stimulatory receptors, whereas alpha 2 is inhibitory. It inhibits all the functions, and alpha 1 is GQ. Now, how they works is an important thing to discuss. For now, just grab this point. Okay, you can write it also somewhere. Now, mechanism of action of cholinergic receptors, when we talk about, you see this muscarinic and nicotinic. So the nicotinic works on the principle of ion channels, that is sodium potassium ion channels. Okay, don't worry, I will explain you how these ion channels are opened. But when I talk about this muscarinic, I have this G coupled protein receptor. This works on the principle of second messenger system again. Okay, and we have these 5 muscarinic receptors, M1 to M5. It is not mentioned here. You can write it in your book, okay, or any notes, any copy, that we have M1 to M5 5 receptors. Okay, so I will tell you that. Then we have this because dopaminergic is a part of adrenergic, so these receptors also work on the principle of second messenger system. Whenever you see G written, just make sure we are talking about the second messenger system. So D1 is a stimulatory and D2 is inhibitory. And where are these D receptors present? If you remember from today's pharmacology lectures, they are present at the kidney, the renal vasculature. Okay, now this is the real game that you need to understand. It will help you not only in understanding pharmacology or neurophysiology, it will help you in endocrine also. Okay, so this is very important in understanding endocrinology. So you see, this is called this is a 7-pass receptor. The G protein coupled receptors are the 7-pass. So we also call them 7-pass serpentine receptors. We also do call them second messenger system. Okay, so basically they are 7 like this. Okay, I've made 6, I guess. They are like 7. Okay, they are 7. So okay, they are like 1 2 3 4, forget about the drawing, 6 and 7. Okay, they're like this, and this is the receptor. So it can be anything. It's not necessary that it is beta. If we're talking about epinephrine, then it is beta 1 beta 2. If I'm talking about acetylcholine, then it is different. Now in your notes or in your book, you can write and you can mention that this is GS. Okay, we are studying the stimulatory system over here right now. So in case of acetylcholine, okay, just you can like write it down somewhere. When we talk about acetylcholine, Okay, the for GQ, okay, this is for GQ, it works. The receptors are M1, M3, and M5. Okay, the receptors are M1, M3, and M5. People, we will be having this class disconnected at after 10 minutes, okay, because of the 40-minute time limit by Zoom. So we will be continuing this lecture till 8 o'clock. Okay, so you have to rejoin it as soon as it ends. Okay, if you want to take it, like, just click on the same link and you can rejoin it. Okay, the same link from which you have joined this lecture. Okay, so acetylcholine, when we're talking about GQ, it is M1, M3, and M5. Okay, and it works with that IP3 system. So just write it down in your notes. I will be explaining you those systems. Okay, just write these things. They are very important. And when I talk about GI, I'm only telling you about acetylcholine right now, not epi or norepinephrine. When I'm talking about GI, the receptors will be M2 and M4. Okay, the receptors will be M2 and M4. So these little things have lots and lots of importance in understanding. So what about the GS? We have seen GQ and we have seen GI. So when I'm talking about acetylcholine and I'm talking about the GS system, you will see all kinds of receptors at that particular level. Okay, for the GS. So these are just an exception to these receptors M1, M3, M5, and then M2, M4. And then again, before making you understand this setup, same, you have to just know, or you can just write it down somewhere, the locations of these receptors. Now, if I'm talking about this M1 receptor, okay, so that M1 receptor will be present on the sympathetic postganglion neurons. For example, this is a preganglion, okay, and this is a postganglion. So the receptors present over here will be M1, okay. So this is the location of M1. All sympathetic postganglionic neurons have M1. Okay, and what will be the neurotransmitter here? Acetylcholine, definitely. Okay, and when I'm saying sympathetic, it means I'm talking about which gland? I'm talking about particularly sweat gland, okay, because we only see sweat gland with muscarinic receptor. Okay, the other sympathetic ones do not have M. They all have adrenergic ones, either alpha 1, alpha 2, or beta 1, beta 2. Getting my point? So remember the location of M1 receptor. Okay, then let's talk about M2. The location of M2 is cardiac muscles, okay, cardiac muscles and smooth muscles, not skeletal, cardiac muscles and smooth muscles. So smooth muscles of the gut, smooth muscles of the bronchioles, smooth muscle of the detrusor, smooth muscles of the blood vessels. So this M2 is present at these particular levels. So just remember the location of them. It will help you understand the function. Okay, then if I talk about M3, okay, M3 is present at gastric parietal cells. Okay, gastric, I'm not writing it completely, it's difficult to write via keyboard. Gastric parietal cells, okay. M3 is present at the level of gastric parietal cells and vascular endothelium, the endothelial lining of the blood vessel. This is a blood vessel and this is the endothelium, okay. This is the endothelium. So it is present in this endothelial lining, this M3, okay. And also vascular smooth muscles. Also remember at this endothelial lining has both M3 and M5, okay. M3 and M5. Gastric parietal cells only have M3. Also vascular smooth muscles, okay. Then there is muscles, so those also have this M3, okay. Now M4 is left. There is one very interesting point about M4. CNS. M4 is present at CNS plus at all these other locations. Gastric parietal cells, endothelial lining of smooth muscles, cardiac muscles, etc., etc., etc. So, but the important is CNS, okay? So you have to remember this thing with M4. It can be asked in your MCQs. So here you are clear with the locations, okay. Now I will move to this second messenger system, okay. So let's take the example of epinephrine. This is a 7-pass serpentine receptor, okay. And this is a 7-pass serpentine receptor, and you see we have these 3 subunits: alpha S, beta S, and gamma S. Okay, now we have this guanosine diphosphate. It was earlier attached with guanosine diphosphate, but when epinephrine was not present, it was attached with GDP. But then epinephrine comes and binds to this receptor, GDP goes away, and GTP is binded with it. Okay, GDP goes away and GTP binds with it. Then what happens? This 3 set of subunits dislodged, and beta S and gamma S are separated from this alpha subunit. Okay, now this is activated. It will activate this enzyme which we called adenylyl cyclase. Okay, this enzyme will be activated, and that enzyme will convert the ATP into cyclic AMP. This is all biochemistry, okay. You should learn these mechanisms. So adenylyl cyclase will convert ATP to cyclic AMP, and cyclic AMP in return would activate protein kinase, which is the most important MCQ for GS. Remember this word and this word with GS mechanism. Okay, so what protein kinase will do? It will do phosphorylation. Okay, kinases always do phosphorylation, that is they add phosphate groups. Okay, it will activate the transcription factors, that is it will be involved in the process of gene expression. Okay, and they will phosphorylate the ion channels, causing depolarization. Now, which ion channels? Sodium and potassium. Okay, sodium and potassium ion channels in case where there is Okay, this is just an example, okay, of epinephrine. Just take, it is not epinephrine, it is acetylcholine, and it is and we are dealing with nicotinic receptors. Then you will see sodium and potassium ion channels will be open. There will be an influx of these ions, and it will cause depolarization. Okay, but when there will be epinephrine, it will not be sodium and potassium. If it is a heart receptor, then you will see calcium. Okay, so this is how the second messenger system works.